Welcome. In this NCLEX Mastery session, you'll tackle 50 high-yield nursing fundamentals questions focused on ethics, law, and HIPAA, topics that frequently appear on the NCLEX and often challenge even well-prepared candidates. These questions are designed to strengthen your clinical judgment on patient rights, confidentiality, informed consent, professional boundaries, documentation, delegation, malpractice, and legal responsibilities. Read each scenario carefully, choose the best answer before the explanation, and think like a safe, competent registered nurse. Let's get started. Question 1. A newly licensed RN is caring for a 42-year-old patient admitted with newly diagnosed HIV infection. During morning rounds, the patient's brother approaches the nurse in the hallway and says, "I'm his brother. Just tell me what's wrong with him. I have a right to know because I'm family." The patient has not identified the brother as someone authorized to receive health information and is fully alert, oriented, and capable of making healthcare decisions. The brother becomes increasingly frustrated and insists that withholding information is unethical. Which nursing action best reflects compliance with both HIPAA regulations and ethical nursing practice? A. Politely explain that the patient's health information cannot be disclosed without the patient's authorization and encourage the patient to decide whom they wish to involve in their care. B. Provide a general overview of the diagnosis without discussing treatment details because immediate family members are entitled to basic information. C. Ask the healthcare provider to speak with the brother since physicians are permitted to disclose confidential information. D. Share the information because the brother is likely involved in the patient's future care. Answer. A. Politely explain that the patient's health information cannot be disclosed without the patient's authorization and encourage the patient to decide whom they wish to involve in their care. Rationale. HIPAA protects patient privacy regardless of family relationship. A competent adult controls who may receive health information. Respecting autonomy and confidentiality requires obtaining the patient's permission before sharing protected health information. Question 2. A nurse working in the emergency department receives a call from a local television reporter requesting confirmation that a well-known community leader has been admitted following a motor vehicle collision. The reporter states that the public has a right to know because the individual is a public figure and promises not to publish treatment details. The patient is currently stable but has not consented to releasing any information. What is the nurse's most appropriate response? A. Confirm only that the patient is hospitalized, but decline further questions. B. State that no information regarding any patient can be confirmed or disclosed without appropriate authorization and refer the request according to facility policy. C. Provide the patient's condition without identifying injuries. D. Transfer the call directly to another nurse. Answer. B. State that no information regarding any patient can be confirmed or disclosed without appropriate authorization and refer the request according to facility policy. Rationale. HIPAA applies equally to public figures. Nurses must not confirm a patient's presence or disclose protected health information without authorization unless permitted by law or institutional policy. Question 3. A competent 68-year-old patient with end-stage heart failure refuses a recommended life-saving surgical procedure after receiving extensive education regarding the risks and benefits. The patient's family strongly disagrees with the decision and asks the nurse to persuade the patient to change their mind. Which ethical principle should primarily guide the nurse's response? A. Beneficence. B. Justice. C. Autonomy. D. Fidelity. Answer. C. Autonomy. Rationale. Autonomy recognizes a competent patient's legal and ethical right to make informed healthcare decisions, including refusing recommended treatment, even when others disagree. Question 4. A nurse accidentally administers the wrong dose of an antihypertensive medication. The patient remains asymptomatic, and the error is quickly recognized. Which action best demonstrates ethical and legal nursing practice? A. Document only the patient's assessment findings and avoid mentioning the medication error. B. Immediately assess the patient, notify the healthcare provider and supervisor, disclose the error according to policy, and complete an incident report. C. Wait to determine whether complications develop before reporting the event. D. Ask the next nurse to continue monitoring without mentioning the error. Answer. B. Immediately assess the patient, notify the healthcare provider and supervisor, disclose the error according to policy, and complete an incident report. Rationale: medication errors require prompt patient assessment, provider notification, appropriate disclosure, documentation in the medical record, and completion of an incident report according to facility policy. Concealing errors is unethical and may have legal consequences. Question 5. A nursing student asks to photograph an unusual wound for educational purposes using a personal smartphone. The patient verbally agrees, but facility policy prohibits personal devices for patient photography. What should the supervising nurse do? A. Permit the photo since the patient verbally consented. B. Allow the photo if the patient's face is not visible. C. Instruct the student not to use a personal device and follow institutional procedures for obtaining clinical photographs when appropriate. D. Take the photograph using the nurse's personal phone instead. Answer: C. Instruct the student not to use a personal device and follow institutional procedures for obtaining clinical photographs when appropriate. Rationale: patient consent alone does not override institutional policy or HIPAA safeguards. Clinical photographs must be obtained only through approved methods that protect patient privacy and confidentiality. Question 6. A nurse finishes documenting in the electronic health record, EHR, and is urgently called to assist with a patient experiencing respiratory distress. The nurse leaves the computer workstation without logging off. While the nurse is away, an environmental services employee accidentally views another patient's laboratory results displayed on the screen. Which statement best describes the nurse's legal and ethical responsibility? A. No HIPAA violation occurred because the employee did not intentionally access the record. B. The nurse is responsible for failing to safeguard protected health information by leaving the workstation unsecured. C. The environmental services employee is solely responsible because they viewed the information. D. There is no breach because the employee is also a hospital worker. Answer: B. The nurse is responsible for failing to safeguard protected health information by leaving the workstation unsecured. Rationale: HIPAA requires healthcare professionals to protect electronic protected health information, EPHI. Leaving an EHR open where unauthorized individuals can view confidential information violates privacy and confidentiality standards, regardless of whether the access was intentional. Question 7. A postoperative patient tells the nurse, "I don't want my spouse to know I've been diagnosed with hepatitis C. Please don't tell anyone." Later that day, the spouse asks the nurse why additional blood tests are being ordered. What is the nurse's most appropriate response? A. Explain the diagnosis because spouses have the legal right to know about communicable diseases. B. Tell the spouse the patient requested confidentiality and encourage them to discuss concerns directly with the patient. C. Provide limited information without revealing the diagnosis. D. Discuss the diagnosis only if the spouse promises to keep the information confidential. Answer: B. Tell the spouse the patient requested confidentiality and encourage them to discuss concerns directly with the patient. Rationale: a competent patient has the right to control disclosure of personal health information. Unless authorized by the patient or required by law, the nurse must maintain confidentiality. Question 8. An experienced RN delegates routine vital sign measurement to an unlicensed assistive personnel, UAP. During rounds, the UAP reports a blood pressure of 78/42 millimeter of mercury in a postoperative patient but states, "The patient said they feel fine, so I didn't tell anyone right away." Which legal principle places the greatest responsibility on the RN? A. The RN remains accountable for appropriate delegation, supervision, and follow-up of delegated tasks. B. The UAP assumes complete legal responsibility after accepting the delegated task. C. The surgeon is responsible because postoperative orders originated from the provider. D. Responsibility ends once the RN delegates the task. Answer: A. The RN remains accountable for appropriate delegation, supervision, and follow-up of delegated tasks. Rationale: although tasks may be delegated, accountability remains with the RN. The nurse must ensure appropriate supervision, evaluate findings, and intervene promptly when abnormal results are reported. Question 9. A competent patient scheduled for surgery suddenly states, "I've changed my mind. I don't want this operation anymore, while being transported to the operating room. The surgeon has already obtained informed consent earlier that morning. What is the nurse's priority action? A. Encourage the patient to proceed because consent has already been signed. B. Notify the surgical team immediately and communicate that the patient is withdrawing consent. C. Administer the prescribed sedative to reduce anxiety before discussing the decision. D. Ask the patient's family to convince the patient to continue. Answer. B. Notify the surgical team immediately and communicate that the patient is withdrawing consent. Rationale. A competent patient may withdraw informed consent at any time before the procedure. The nurse must advocate for the patient's wishes and immediately notify the healthcare provider and surgical team. Question 10. A nurse overhears two coworkers discussing a patient's diagnosis and prognosis in a crowded hospital elevator where visitors are present. Which action best demonstrates ethical and legal nursing practice? A. Ignore the conversation because both individuals are hospital employees. B. Join the discussion since everyone involved works in healthcare. C. Interrupt the conversation. Remind the coworkers that patient information should not be discussed in public areas, and report repeated violations according to policy if necessary. D. Wait until the end of the shift before mentioning the conversation. Answer. C. Interrupt the conversation. Remind the coworkers that patient information should not be discussed in public areas, and report repeated violations according to policy if necessary. Rationale. Discussing protected health information in public areas where unauthorized individuals may overhear violates HIPAA and professional ethical standards. Nurses have a responsibility to protect patient confidentiality and address unsafe privacy practices. Question 11. A nurse is caring for a 74-year-old patient who speaks limited English and is scheduled for an emergency exploratory laparotomy. The patient's adult son states, "I speak enough English. I'll translate everything for my mother so we don't have to wait for an interpreter." The patient appears confused during the discussion and nods without asking questions. Which nursing action best meets legal and ethical standards regarding informed consent? A. Accept the son's interpretation because he is an immediate family member. B. Delay the procedure until a qualified medical interpreter is available, unless delaying would create an immediate life-threatening emergency. C. Ask another bilingual nurse from a different unit to interpret, even if the nurse is not a qualified medical interpreter. D. Have the patient sign the consent since she is nodding in agreement. Answer. B. Delay the procedure until a qualified medical interpreter is available, unless delaying would create an immediate life-threatening emergency. Rationale. Informed consent requires that the patient understand the nature, risks, benefits, and alternatives of the procedure. Qualified medical interpreters should be used whenever possible. Family members should not routinely serve as interpreters because they may unintentionally omit or alter critical information. Question 12. A nurse documents that a postoperative dressing was clean, dry, and intact at 1400. At 1500, the nurse realizes the dressing was actually saturated with blood at the time of assessment, but forgot to document accurately. Which action is most appropriate? A. Alter the original documentation to match the patient's condition. B. Delete the original note and rewrite the documentation. C. Enter a late entry documenting the correct assessment, the current patient status, and notify the healthcare provider as appropriate. D. Leave the documentation unchanged because correcting it could create legal problems. Answer. C. Enter a late entry documenting the correct assessment, the current patient status, and notify the healthcare provider as appropriate. Rationale. Medical records must be truthful, accurate, and timely. Errors should never be erased or falsified. A properly identified late entry maintains the integrity of the legal medical record. Question 13. A terminally ill patient with decision-making capacity tells the nurse, "I don't want any more aggressive treatments. I only want comfort care." The patient's daughter insists that everything possible must be done to prolong the patient's life. Which nursing action best demonstrates patient advocacy? A. Follow the daughter's wishes because she is the closest family member. B. Support the competent patient's expressed healthcare decisions and communicate those wishes to the healthcare team. C. Remain neutral and avoid participating in the disagreement. D. Delay notifying the provider until the family reaches an agreement. Answer. B. Support the competent patient's expressed healthcare decisions and communicate those wishes to the healthcare team. Rationale. The nurse's primary obligation is to advocate for the competent patient's wishes. Family members cannot override the informed decisions of a patient who has decision-making capacity. Question 14. A nursing student accesses the electronic medical record of a patient admitted to another unit because the patient's condition is interesting and may help prepare for an upcoming examination. The student is not involved in the patient's care. Which statement is correct? A. This is acceptable because the information is being used for educational purposes. B. This is acceptable if the student does not discuss the patient's identity. C. This is a HIPAA violation because the student accessed protected health information without a legitimate need related to patient care. D. This is acceptable if the clinical instructor approves. Answer. C. This is a HIPAA violation because the student accessed protected health information without a legitimate need related to patient care. Rationale. Healthcare professionals and students may access only the records necessary to perform their assigned duties. Curiosity or educational interest alone does not justify accessing protected health information. Question 15. A patient with advanced dementia repeatedly attempts to leave the hospital despite lacking decision-making capacity and being at high risk for serious injury. The healthcare provider prescribes soft wrist restraints after less restrictive interventions have failed. Which nursing action is legally appropriate? A. Apply the restraints indefinitely until discharge. B. Apply the restraints without ongoing assessment because a provider's order has been obtained. C. Use the least restrictive restraint necessary, perform frequent assessments, document the need, and remove the restraints as soon as they are no longer required. D. Delegate restraint monitoring entirely to the UAP. Answer. C. Use the least restrictive restraint necessary, perform frequent assessments, document the need, and remove the restraints as soon as they are no longer required. Rationale. Restraints may be used only when necessary to protect the patient after less restrictive measures fail. Continuous assessment, documentation, and early removal are legal and ethical requirements to protect patient rights. Question 16. A nurse is caring for a 55-year-old patient who is alert, oriented, and receiving palliative care for metastatic pancreatic cancer. During the evening shift, the patient quietly tells the nurse, "Please don't tell my family about my prognosis. I'm not ready to discuss it with them yet." Later that evening, the patient's spouse asks the nurse, "The doctor seems worried. Is my spouse dying?" What is the nurse's most appropriate response? A. Explain that the prognosis is confidential and encourage the spouse to discuss concerns directly with the patient. B. Tell the spouse the prognosis because immediate family members have the right to know. C. Provide a vague answer that suggests the condition is serious without revealing details. D. Discuss the prognosis only if another nurse is present. Answer. A. Explain that the prognosis is confidential and encourage the spouse to discuss concerns directly with the patient. Rationale. A competent patient has the legal right to control the disclosure of personal health information. The nurse must protect confidentiality while encouraging open communication between the patient and family. Question 17. A nurse is preparing to administer a blood transfusion when the patient states, "My religious beliefs prohibit blood transfusions. I understand the risks, and I refuse the transfusion." The provider insists that the transfusion is life-saving and asks the nurse to proceed immediately. What is the nurse's priority action? A. Administer the transfusion because preserving life is the nurse's primary duty. B. Delay the transfusion, notify the healthcare provider immediately, and advocate for the competent patient's informed refusal. C. Ask the patient's family to override the refusal. D. Begin the transfusion while waiting for an ethics consultation. Answer. B. Delay the transfusion, notify the healthcare provider immediately, and advocate for the competent patient's informed refusal. Rationale. Competent adults have the legal and ethical right to refuse treatment, even if the refusal may result in death. The nurse's responsibility is to advocate for the patient's autonomous decision. Question 18. A nurse notices that another RN documented administering an opioid analgesic at 0900, but the medication remains in the automated dispensing cabinet and the patient confirms that no medication was received. Which action is most appropriate? A. Correct the documentation independently. B. Ignore the discrepancy because it is another nurse's responsibility. C. Immediately report the discrepancy through the appropriate chain of command and follow institutional policy. D. Remove the medication and administer it without notifying anyone. Answer: C. Immediately report the discrepancy through the appropriate chain of command and follow institutional policy. Rationale: falsifying documentation is both an ethical and legal violation. The nurse has a duty to protect patient safety, ensure accurate records, and report suspected documentation errors or misconduct according to policy. Question 19. A patient undergoing chemotherapy asks the nurse, "If something happens and I can't make decisions for myself, I want my daughter to make healthcare decisions for me." Which document best accomplishes the patient's goal? A. Living will. B. Durable power of attorney for healthcare, healthcare proxy. C. Do not resuscitate, DNR, order. D. Physician's progress note. Answer: B. Durable power of attorney for healthcare, healthcare proxy. Rationale: a durable power of attorney for healthcare designates another individual to make healthcare decisions if the patient loses decision-making capacity. A living will expresses treatment preferences but does not appoint a decision-maker. Question 20. A nurse accidentally sends a patient's laboratory results to the wrong fax number. The nurse immediately realizes the mistake before receiving confirmation that the fax was viewed. What is the nurse's best initial action? A. Ignore the incident since the recipient may never read the fax. B. Immediately notify the supervisor or privacy officer. Attempt to mitigate the disclosure according to facility policy and complete the required incident documentation. C. Wait until the end of the shift to determine whether anyone reports the error. D. Delete the fax record and avoid documenting the incident. Answer: B. Immediately notify the supervisor or privacy officer. Attempt to mitigate the disclosure according to facility policy and complete the required incident documentation. Rationale: any suspected unauthorized disclosure of protected health information should be reported immediately. Prompt reporting allows the organization to mitigate potential harm, investigate the incident, and comply with HIPAA breach notification requirements. Question 21. A nurse is caring for a competent 38-year-old patient with severe gastrointestinal bleeding who repeatedly refuses a blood transfusion because of deeply held religious beliefs. The patient's hemoglobin continues to fall, and the healthcare provider tells the nurse, "Don't tell the patient how critical the lab results are. If they don't understand the severity, they'll be less likely to refuse." Which nursing action is most appropriate? A. Follow the provider's request because it may save the patient's life. B. Provide complete and truthful information. Advocate for the patient's right to make an informed decision and notify the provider of the patient's continued refusal. C. Ask the patient's family to consent on the patient's behalf. D. Delay discussing the laboratory results until the provider speaks with the patient. Answer: B. Provide complete and truthful information. Advocate for the patient's right to make an informed decision and notify the provider of the patient's continued refusal. Rationale: respect for autonomy and veracity requires that competent patients receive accurate information to make informed decisions. Nurses must advocate for informed refusal and cannot intentionally withhold relevant information. Question 22. A nurse is floated to another unit and is asked by a coworker to administer an unfamiliar chemotherapy medication because the coworker is busy. The nurse has never been trained or certified to administer chemotherapy. What is the most appropriate response? A. Administer the medication after reviewing the drug guide. B. Decline the assignment. Explain the lack of competency and notify the charge nurse to ensure safe patient care. C. Administer half the dose while another nurse observes. D. Ask the patient to wait until the coworker returns. Answer: B. Decline the assignment. Explain the lack of competency and notify the charge nurse to ensure safe patient care. Rationale: nurses are legally and professionally accountable for practicing within their scope of competence. Accepting assignments beyond one's training places patients at risk and may constitute negligence. Question 23. A patient who underwent surgery earlier in the day is recovering in a semi-private room. While updating the patient's chart, the nurse notices that the roommate's visitors are listening as the healthcare team discusses the patient's pathology results. What is the nurse's best action? A. Continue the discussion because both patients are hospitalized. B. Move the conversation to a private area or lower voices to protect patient confidentiality. C. Ask the visitors to promise they will not repeat what they hear. D. Ignore the situation because it is the provider's responsibility. Answer. B. Move the conversation to a private area or lower voices to protect patient confidentiality. Rationale. Protected health information should be discussed only in a manner that minimizes the risk of unauthorized disclosure. Nurses must take reasonable steps to protect patient privacy. Question 24. A patient scheduled for an elective colonoscopy receives midazolam for sedation. Moments later, the provider realizes that the informed consent form was never signed. What should the nurse do? A. Obtain the patient's signature immediately before the medication takes full effect. B. Inform the provider that informed consent cannot be validly obtained after the patient has received sedation that may impair decision-making. C. Ask the patient's spouse to sign instead. D. Proceed because the patient verbally agreed earlier. Answer. B. Inform the provider that informed consent cannot be validly obtained after the patient has received sedation that may impair decision-making. Rationale. Valid informed consent requires that the patient have decision-making capacity and be free from impairment. Sedative medications may compromise the patient's ability to provide legally valid consent. Question 25. A nurse receives a friend request on a personal social media account from a patient who was discharged 2 days ago. The patient writes, "Thank you for taking such good care of me." Which response best reflects professional and ethical nursing practice? A. Accept the request because the patient has already been discharged. B. Politely decline the request and maintain professional boundaries. C. Accept the request but avoid discussing healthcare. D. Accept temporarily and remove the patient later. Answer. B. Politely decline the request and maintain professional boundaries. Rationale. Maintaining professional boundaries protects both the patient and the nurse. Personal social media relationships with current or former patients may create ethical and professional conflicts. Question 26. A nurse discovers that another nurse documented performing a complete neurological assessment that was never actually completed. Which action is most appropriate? A. Report the incident through the appropriate chain of command according to facility policy. B. Complete the assessment and ignore the false documentation. C. Correct the coworker's documentation without informing anyone. D. Wait until the next shift to determine whether the assessment becomes necessary. Answer. A. Report the incident through the appropriate chain of command according to facility policy. Rationale. Falsification of medical records is unethical, illegal, and jeopardizes patient safety. Nurses have a professional duty to report unsafe or fraudulent practices. Question 27. A nurse is caring for a patient with active pulmonary tuberculosis who insists on leaving the negative pressure isolation room to visit another patient. Which ethical principle best justifies restricting the patient's movement? A. Justice. B. Non-maleficence by preventing harm to others. C. Fidelity. D. Veracity. Answer. B. Non-maleficence by preventing harm to others. Rationale. Although patients have rights, those rights may be limited when necessary to prevent significant harm to others. Protecting the public from communicable disease is consistent with non-maleficence. Question 28. A nurse accidentally administers a medication to the wrong patient because 2 patients have similar names. The patient experiences no adverse effects. What documentation is appropriate? A. Document the medication administration exactly as it occurred, the patient assessment, provider notification, interventions, and complete an incident report according to policy. B. Document only that the patient remained stable. C. Do not document the error since no harm occurred. D. Wait to document until the manager reviews the incident. Answer. A. Document the medication administration exactly as it occurred, the patient assessment, provider notification, interventions, and complete an incident report according to policy. Rationale. Medication errors must be accurately documented in the patient's medical record along with assessments and interventions. Incident reports are completed separately according to institutional policy. Question 29. A competent patient with chronic kidney disease tells the nurse, "I understand dialysis could prolong my life, but I don't want it anymore." The patient's children insist the nurse should convince the patient otherwise. What is the nurse's priority responsibility? A. Respect and advocate for the competent patient's decision after ensuring it is informed. B. Encourage the children to obtain emergency guardianship. C. Delay documenting the refusal until the provider speaks with the family. D. Ask the ethics committee to overrule the patient's decision. Answer: A. Respect and advocate for the competent patient's decision after ensuring it is informed. Rationale: competent adults have the legal right to refuse treatment. The nurse's responsibility is to verify that the decision is informed, advocate for the patient's wishes, and communicate them to the healthcare team. Question 30. A nurse observes another staff member searching the electronic health record of a hospitalized celebrity without participating in the patient's care. When questioned, the staff member says, "I was just curious." What should the nurse do? A. Ignore the behavior because no information was shared. B. Immediately report the unauthorized access according to institutional policy. C. Verbally warn the coworker but take no further action. D. Wait to see whether the access occurs again. Answer: B. Immediately report the unauthorized access according to institutional policy. Rationale: accessing a medical record without a legitimate treatment, payment, or healthcare operations need is a HIPAA violation. Nurses have an ethical and legal duty to report unauthorized access to protect patient confidentiality. Question 31. A nurse is caring for a 46-year-old patient who underwent surgery for a bowel obstruction. During the evening assessment, the patient quietly tells the nurse, "I don't want my wife to know that the pathology report showed cancer. I need time to process this myself." 30 minutes later, the patient's wife asks the nurse, "Did the biopsy come back? Please tell me the truth." Which nursing response best complies with ethical and legal standards? A. Tell the wife the diagnosis because spouses are legally entitled to receive all health information. B. State that you cannot disclose the patient's medical information without permission and encourage her to discuss the results directly with the patient. C. Confirm that the biopsy is abnormal but avoid using the word cancer. D. Ask another nurse to answer the question. Answer: B. State that you cannot disclose the patient's medical information without permission and encourage her to discuss the results directly with the patient. Rationale: a competent patient controls who receives protected health information. Marriage alone does not authorize disclosure. The nurse must maintain confidentiality while promoting communication between the patient and spouse. Question 32. A charge nurse notices that an RN consistently leaves narcotics unsecured on the medication cart while responding to patient requests. Although no medications are missing, the practice continues despite previous reminders. Which action is most appropriate? A. Ignore the behavior because no patient has been harmed. B. Report the unsafe practice through the appropriate chain of command and document according to institutional policy. C. Lock the medications without discussing the issue. D. Wait until a medication is actually lost before taking action. Answer: B. Report the unsafe practice through the appropriate chain of command and document according to institutional policy. Rationale: nurses have a legal and ethical obligation to report unsafe practices that place patients and controlled substances at risk. Early intervention helps prevent patient harm and diversion. Question 33. A nurse is preparing a patient for an elective cardiac catheterization. Immediately before transport, the patient states, "I don't think I understand the risks anymore. I'm not sure I want this procedure." What should the nurse do first? A. Ask the patient to sign the consent form anyway because it was previously explained. B. Notify the healthcare provider so additional explanation can be provided before proceeding. C. Explain the procedure independently and obtain consent. D. Administer the prescribed sedative to decrease anxiety. Answer: B. Notify the healthcare provider so additional explanation can be provided before proceeding. Rationale: the provider performing the procedure is responsible for ensuring informed consent. If the patient expresses uncertainty or lacks understanding, the procedure should be delayed until adequate information is provided. Question 34. A nursing student posts on social media, "Today I cared for a 24-year-old trauma patient injured in a motorcycle crash. What a heartbreaking day." The patient's name and photograph are not included, but the incident received extensive local news coverage. Which statement is most accurate? A. This is acceptable because no identifying information was posted. B. This may violate HIPAA and professional standards because sufficient information may allow others to identify the patient. C. This is acceptable if the account is private. D. This is acceptable because the patient was already in the news. Answer: B. This may violate HIPAA and professional standards because sufficient information may allow others to identify the patient. Rationale: even without a name or photograph, details shared on social media may identify a patient. Nurses must avoid posting patient-related information that could compromise confidentiality. Question 35. A patient with advanced Alzheimer's disease is unable to understand treatment options. The patient has a legally appointed durable power of attorney for healthcare. Which individual should provide consent for a non-emergency surgical procedure? A. The patient's closest friend. B. The healthcare provider. C. The legally appointed durable power of attorney for healthcare. D. The charge nurse. Answer: C. The legally appointed durable power of attorney for healthcare. Rationale: when a patient lacks decision-making capacity, the legally designated healthcare proxy or durable power of attorney for healthcare makes decisions according to the patient's wishes and best interests. Question 36. A nurse administers an incorrect insulin dose after misreading the medication administration record. The patient develops symptomatic hypoglycemia, requiring emergency treatment. Which legal concept is most applicable? A. Assault. B. Negligence, malpractice. C. False imprisonment. D. Defamation. Answer: B. Negligence, malpractice. Rationale: malpractice occurs when a healthcare professional breaches the standard of care, resulting in patient harm. Medication administration errors causing injury are classic examples. Question 37. A patient signs a consent form for a left knee replacement. In the operating room, the surgeon states that the right knee actually appears worse and wants to proceed on the right side instead. The patient is under general anesthesia. Which action by the circulating nurse is most appropriate? A. Allow the surgery because the surgeon believes it is in the patient's best interest. B. Stop the procedure and notify the surgical team that valid informed consent for the right knee has not been obtained. C. Ask another nurse for a second opinion. D. Contact the patient's family for verbal permission. Answer: B. Stop the procedure and notify the surgical team that valid informed consent for the right knee has not been obtained. Rationale: surgery may only be performed on the procedure for which informed consent has been obtained, except in true life-threatening emergencies. The nurse is responsible for advocating for patient safety and legal compliance. Question 38. A nurse caring for a patient with newly diagnosed HIV infection is asked by another nurse from a different unit, "I heard that patient has HIV. Is it true?" The second nurse has no involvement in the patient's care. What is the best response? A. Confirm the diagnosis because both individuals are licensed nurses. B. Decline to discuss the patient's health information because the coworker has no legitimate need to know. C. Confirm the diagnosis but request confidentiality. D. Refer the coworker to the patient's provider. Answer: B. Decline to discuss the patient's health information because the coworker has no legitimate need to know. Rationale: access to and discussion of protected health information is limited to individuals directly involved in the patient's care or other authorized purposes. Professional curiosity is not a legitimate reason. Question 39. A competent patient repeatedly refuses prescribed pain medication despite reporting severe pain. The nurse believes the patient would benefit from treatment. Which ethical principle should guide the nurse's response? A. Autonomy. B. Justice. C. Fidelity. D. Veracity. Answer: A. Autonomy. Rationale: competent patients have the right to accept or refuse treatment after receiving appropriate education. The nurse should assess the patient's concerns, provide education, and respect the informed decision. Question 40. A nurse witnesses another nurse intentionally documenting assessments that were never performed. The reporting nurse fears workplace retaliation if the incident is reported. Which action best reflects professional and legal accountability? A. Remain silent because reporting could damage workplace relationships. B. Report the falsification through the appropriate reporting channels while following institutional whistleblower and reporting policies. C. Correct the documentation independently without informing anyone. D. Wait until another coworker reports the incident. Answer. B. Report the falsification through the appropriate reporting channels while following institutional whistleblower and reporting policies. Rationale. Nurses are ethically and legally obligated to protect patient safety and maintain the integrity of the medical record. Falsification of documentation must be reported through the appropriate chain of command. Question 41. A nurse is caring for a 70-year-old patient who has mild hearing impairment but is fully alert and competent. The healthcare provider enters the room and begins explaining the risks and benefits of a high-risk surgical procedure while facing away from the patient and speaking rapidly. After the provider leaves, the patient tells the nurse, "I couldn't understand most of what was said, but I signed the consent because everyone seemed to be in a hurry." What is the nurse's best action? A. Notify the healthcare provider that the patient does not appear to understand the procedure and request that the informed consent discussion be repeated before surgery. B. Witness the patient's signature because the consent form has already been signed. C. Tell the patient the surgery can always be canceled afterward. D. Ask a family member to explain the procedure. Answer. A. Notify the healthcare provider that the patient does not appear to understand the procedure and request that the informed consent discussion be repeated before surgery. Rationale. A valid informed consent requires that the patient understands the procedure, risks, benefits, and alternatives. If the nurse believes the patient lacks understanding, the provider must clarify the information before the procedure proceeds. Question 42. A nurse caring for a postoperative patient receives a phone call from an individual claiming to be the patient's insurance representative and requesting laboratory results. The caller cannot verify required identifying information according to hospital policy. What should the nurse do? A. Release the laboratory results because insurance companies pay for the patient's care. B. Decline to disclose the information until the caller's identity and authorization have been verified according to institutional policy. C. Provide only the abnormal laboratory results. D. Transfer the call to another nurse. Answer. B. Decline to disclose the information until the caller's identity and authorization have been verified according to institutional policy. Rationale. Protected health information should only be disclosed to authorized individuals after proper verification. Nurses must follow institutional procedures before releasing patient information. Question 43. A nurse accidentally administers an oral medication intended for another patient. The error is immediately recognized, and the patient remains stable. After notifying the provider, what should the nurse do next? A. Document the error, the patient's assessment, interventions taken, provider notification, and complete an incident report according to policy. B. Document only that the medication was administered. C. Wait until the patient develops symptoms before documenting. D. Ask the charge nurse to document the event instead. Answer. A. Document the error, the patient's assessment, interventions taken, provider notification, and complete an incident report according to policy. Rationale. Medication errors require prompt documentation of the facts, patient assessment, interventions, and provider notification. An incident report is completed separately for quality improvement and risk management. Question 44. A patient scheduled for discharge tells the nurse, "I don't want my adult children to know that I was treated for alcohol use disorder." The children later request a copy of the discharge summary. Which nursing response is most appropriate? A. Provide the discharge summary because they are immediate family. B. Refuse to release the records unless the patient has authorized disclosure or another legal exception applies. C. Give the children a verbal summary instead. D. Ask the physician to decide. Answer. B. Refuse to release the records unless the patient has authorized disclosure or another legal exception applies. Rationale. Competent adults control access to their medical records. Family members cannot receive protected health information without patient authorization unless permitted by law. Question 45. A nurse is assigned to care for a close personal friend admitted with complications of uncontrolled diabetes. The nurse feels emotionally involved and worries that personal feelings may affect professional judgment. Which action is most appropriate? A. Continue providing care because friendship improves trust. B. Inform the charge nurse and request reassignment if professional objectivity may be compromised. C. Continue caring for the patient but avoid documenting sensitive information. D. Ask the friend to keep the relationship confidential. Answer. B. Inform the charge nurse and request reassignment if professional objectivity may be compromised. Rationale. Nurses should avoid situations in which personal relationships interfere with professional judgment or create boundary concerns. Reassignment helps protect both the patient and the nurse. Question 46. A patient who lacks decision-making capacity has no advance directive or healthcare proxy. The healthcare team cannot reach any family members despite repeated attempts. The patient requires immediate emergency surgery to prevent imminent death. Which action is legally appropriate? A. Delay surgery until a family member can be located. B. Proceed with emergency treatment under the doctrine of implied consent. C. Cancel the surgery because written consent is unavailable. D. Ask the bedside nurse to sign the consent form. Answer. B. Proceed with emergency treatment under the doctrine of implied consent. Rationale. In life-threatening emergencies, when a patient lacks capacity and no surrogate is available, implied consent permits necessary treatment to preserve life or prevent serious harm. Question 47. A nurse overhears another nurse making false, damaging statements about a co-worker's professional competence to several staff members, despite knowing the statements are untrue. Which legal concept best describes this behavior? A. Battery. B. Assault. C. Defamation, slander. D. False imprisonment. Answer. C. Defamation, slander. Rationale. Slander is spoken defamation that falsely harms another person's reputation. Healthcare professionals are expected to communicate truthfully and professionally. Question 48. A patient is placed in soft wrist restraints because of repeated attempts to remove a life-sustaining endotracheal tube. During hourly assessment, the patient is calm, follows commands, and no longer attempts to remove the tube. What should the nurse do? A. Continue the restraints until the next provider assessment. B. Remove the restraints, continue close observation, and reassess the need frequently according to policy. C. Tighten the restraints to prevent future attempts. D. Leave the restraints in place until the end of the shift. Answer. B. Remove the restraints, continue close observation, and reassess the need frequently according to policy. Rationale. Restraints should be discontinued at the earliest possible time once they are no longer necessary. Nurses must use the least restrictive intervention while maintaining patient safety. Question 49. A nurse notices a co-worker repeatedly accessing electronic health records using another employee's login credentials because it's faster. Which action is most appropriate? A. Ignore the behavior because patient care is not affected. B. Report the security violation immediately through the appropriate chain of command. C. Share personal login credentials to help the coworker. D. Change the coworker's password without permission. Answer. B. Report the security violation immediately through the appropriate chain of command. Rationale. Sharing login credentials violates HIPAA security requirements and institutional policies. Individual user accounts provide accountability and protect patient information. Question 50. A newly licensed nurse asks an experienced RN, "What is the single most important legal responsibility I have every shift?" Which response is most accurate? A. Always complete documentation before patient care. B. Follow every provider order without question. C. Protect patient safety, practice within the nursing scope of practice, maintain confidentiality, and advocate for the patient's rights even when it is difficult. D. Ensure every patient is discharged on time. Answer. C. Protect patient safety, practice within the nursing scope of practice, maintain confidentiality, and advocate for the patient's rights even when it is difficult. Rationale. The nurse's core legal and ethical responsibilities include patient advocacy, safe practice, confidentiality, accountability, accurate documentation, and adherence to professional standards. These principles form the foundation of safe nursing care and are heavily tested on the Nclex. Excellent work completing all 50 questions. Mastering ethics, law, and HIPAA is essential because these principles guide every nursing decision you make, both on the Nclex and in clinical practice. If you found any questions challenging, review the rationales and revisit the concepts until you're confident. Consistent practice with complex clinical scenarios is one of the best ways to sharpen your judgment and prepare for exam success. Keep studying, stay consistent, and I'll see you in the next Nclex practice session.